I'm Dr. Daniel Stock of PureHealth Functional Family Medicine, and we're going to discuss chronic inflammatory response syndrome and the Shoemaker protocol as it applies to autism patients. In nearly every chronic disease we look at, especially neurologic and behavioral chronic diseases, what we find is there is a problem either with chronic inflammation of the body or a chronic dysregulation of how the body controls inflammation. Eventually, this leads to convincing the part of the brain that we call the hypothalamus to treat the body as if it's fighting off a virus infection for the remainder of its life. So there was a pediatrician who, learning about Dr. Shoemaker's protocol, which is a protocol to remove all of the inflammation from the body and then to reboot that inflammation control system inside of the brain so it would no longer think it was fighting a virus off, and applied this to a patient who had the PANS form of autism with complete relief of the patient's symptoms. When I first met this young lady, she was actually interacting with other people on a very limited basis. On her first appointment in my office, the only thing she ever said to me was, "Don't look in my ears," and probably said it about every 30 seconds. This particular patient, we found out, had a biotoxin sensitivity that was leading to her inflammatory cause. After changing around her inflammation and starting her on medicine to remove the biotoxins that were accumulating in her body, the mother told me that she assisted in planning her own birthday party and actually played with her friends. Autism is a very, very broad spectrum of conditions. While we're nearly sure that inflammation is involved in all of them, because we can't say for sure, because we've treated 5,000 of every type of autism patient, that we know the Shoemaker protocol will cure all of them, it is very likely that a very large percentage of these people will respond to Shoemaker protocols. The Shoemaker protocol is actually a very arduous process, usually requiring dietary changes, changes in living conditions, and mold remediation, and requires the use of some agents that may not be covered by insurance. It takes a fairly skilled physician to try and guide people through the financial consequences of this and to make sure that they have things like home remediation done in ways that don't bankrupt and financially burden the family. I'm Dr. Daniel Stock at PureHealth Functional Family Medicine. If there's anything you think I can do for someone with autism, please feel free to contact us at 317-559-2515, or you can reach us through our website at www.purehealthmed.com or email us at drstock@purehealthmed.com.